Jody, you want to go ahead and tell us about the second tape that we have for our audience?
It is to Kendall Counseling Center again, and we're looking here at a stress module. And what really is being emphasized is imagery, visualization, and these are tools that are becoming even more prominent when we look at cancer, when we look at terminal diseases. It can really bring a client or a patient inside of themselves to really look in on certain elements, certain extrasensory perception from within. In another of her treatment rooms, this happens to be the stress treatment room, and another of the modalities for stress management that Diane uses in her work. Diane, do you want to describe what it is that this is all about, this module?
I'd be more than happy to, Jody. What we're doing is we're using this modality as a way to tap into the sensory, the visual, the auditory, and the olfactory smell, all the different senses for someone as a way to enhance their memory and their learning, to work on different problem areas of stress management. We use it for anxiety. We use it for addictions. We use it as a way to enhance self-esteem, and as you can see, we have the beautiful videos that we work with, and we have sound, and we have music, and it's a real nice way to get the client into a very relaxed state so that we can help teach them new skills to enhance their life.
And where did you first encounter such a module?
Well, Jody, this has been around probably for about 6 years. I first found out about it when I went to Washington to the U.S. Psychiatric Conference, and I recognized it as a great vehicle to enhance this for my clients, and decided that I wanted to be one of the first ones to have it in Florida. They have not put it anywhere else, but West Point Academy has been using it, and they used it for the U.S. Olympic team as a way to enhance peak performance. So I found that if other people were using it at kind of the optimal level of performance, that why not give this to our clients as a way to help us deal with stress.
I would say this is a brilliant idea. And what kind of empowering effects does this have on your patients and your clients? What do you notice about the effects of this?
I think I noticed the change in the behavior and the change in attitude toward things, and actually an empowerment of them actually being able to do this, okay, and being able to have the tools at any time to be able to recall on being able to relax themselves. So I find that my clients are real positive about it, and it isn't really a crutch, but it's an extra addition to being able to help them with different areas in their life.
Diane, how do you design different programs for your clients using this module?
Well, Jody, I really like to kind of customize the treatment, because every client that comes in, they're very different and very unique. And I really like to look at the client and look at areas that they're having problems with. And then I design a program that perhaps meets the needs that they want, because every client has different needs. Some may want to manage stress, some may want to manage anxiety, some may want to learn just relaxation techniques. So really, it really depends on the client's needs. But I have about 700 different programs that I can use. So as you can see, I have a great library of being able to pull from different resources and actually custom designing a program and tailoring it to their needs.
I would say. And in working with this module, have you found it effective in enhancing your clients' progress that much more? Is it, I know you do hypnotherapy. How would you look at the formula for hypnotherapy and using this module?
Well, Jody, I think one of my biggest concerns was I was doing hypnotherapy and using it as a way to help heal clients in different stages of treatment, and I found that it was taking longer to do it that way. This is a faster vehicle, okay, of being able to actually help the client heal in a faster way. I found that my clients can have shorter treatment, okay, it's not a long-term treatment, and insurance companies are forcing us to look at more effective treatment, and this is the vehicle that really helps us get there much faster. So I felt that it's been very important for my practice to use it.
I would say. And how do people, in coming into this module, you see their responses? What is apparent from someone? I feel myself sitting here as if I'm very much at ease, and do you sense that this actually allows for them to go deeper inside, to reach a point that they might not necessarily reach without this module?
Absolutely. I find that clients that come in here with a lot of anxiety and maybe preconceived notions of what therapy is going to be about, they are actually leaving here with a completely different attitude and feeling as though this has been a very safe environment, an environment that actually teaches them new skills and really works on changing behaviors, because that's exactly what the vehicle is used for.
As you can see from the tape that we just showed, we are talking about many different modalities in order to deal with stress. Stress comes in many forms, and stress can be treated in many different ways. The effects of stress certainly are profound, and certainly everybody, I think, here understands that it affects our immune system as well. I think we all owe it to ourselves to do something about that and take charge. The ways of taking charge certainly are illustrated in a couple of the tapes that we showed you, and there are many other ways as well. The important thing is to take information from your education and bring it back with you. You're not going to get it on the first couple of tries. It's not easy. It may look easy, but it's not easy. You have to constantly retrain yourself and talk to yourself in order to get the message across and re-script or reprogram your life. Any comments? We're going to go some closing remarks.
Well, I think that we certainly owe it to ourselves to explore, move beyond the territories and the boundaries that exist now, and really take a very adventuresome approach to our healing and to stress in our lives.
Miguel?
Psychosomatic used to be used as a cop-out word, and it's actually the reality of life. It's actually most of the illness that is hurting us at the moment are attached to psychosomatic. So once again, I have to go back to the way we view that glass. We should begin to view it half full.
And I like being able to have the opportunity to teach people to be responsible for themselves and to teach them the new tools that they can learn to empower themselves and to manage their life a little bit better. So I think it's important.
As we have shown you here, we have talked about ways to address stress. Our next show will deal with stress as it affects relationships and sexuality. We hope you'll join us.
Thank you.